Welcome to 6ABC's Weekend Extra, paid for by Mainline Health. Here's Jessica Boynton.
A picture says 1,000 words, and when it comes to your heart, it's no different. While we often think about prevention of heart disease through lifestyle changes and medications, cardiac imaging plays an important role too. Cardiac imaging is a critical step in the accurate diagnosis of many heart conditions. Chest pains, heart flutters, and heart attacks, they are all signposts of heart troubles. With us today is Dr. Harish Jarrett, cardiologist with the Lehigh All Heart Institute, part of Mainline Health. Dr. Jarrett specializes in cardiac imaging, helping patients receive a proper diagnosis and work on a treatment plan to get patients back to better health. Dr. Jarrett, welcome.
Hi, thanks for having me.
Yeah, thanks so much for being here with us today. Now we're going to get right to it. When someone goes to their cardiologist and an imaging study is ordered, what is the physician trying to find out?
I think first they're listening to cues from your story, trying to figure out what's important and what warrants looking into in more detail. They'll then do a physical examination, and using these two things, they may order additional testing for you. This is mainly to figure out what possibilities there could be.
All right, so you know what, that essentially brings me to my next question. What types of cardiac imaging may be ordered? What do they need?
It can be such a confusing thing to come out of a cardiologist's office and have all these different tests on your piece of paper. But to start with, at least, most offices will do an ECG, which is an electrical tracing of your heart. Commonly, they'll do an echocardiogram, which is an ultrasound of your heart, which is very similar to baby ultrasounds or fetal ultrasounds, looking at heart function, valve function, how well is your heart performing at that very moment. Beyond that, gets a little bit more complicated. If you're concerned about coronary artery disease, you can get CAT scans of your heart. There are a variety of these on offer. Last but certainly not least, there's cardiac MRI testing and nuclear cardiac testing, which gets into more nuanced issues to do with the heart, but are very important in 2021 to be able to have these at our disposal.
Okay, so tell me what advice you would give to patients to manage their heart disease.
I would say, first and foremost, understand the instructions that are given to you by your physician. Like I said, it's very anxiety-provoking to come out of your doctor's office, but make sure you understood what they wanted for you and what you wanted from them as well. Become a master of your numbers. By that, I mean, know what your normal blood pressure should be, understand what your cholesterol numbers are, ask them if they haven't volunteered that, and they're different for everybody. So make sure you know what your numbers should be. If you're diabetic, make sure that your diabetes is under good control. That's really important. And lastly, I think getting the 150 minutes of exercise a week is really important for everybody. Certainly, if you're able to exercise, that should be a goal that we should all be aiming towards.
Right, I'm going to try to do that this week myself. How does Lehigh All Heart Institute help patients with cardiac disease?
I think we have a great, compassionate staff. We work really hard to make everybody's experience very individualized, and couple that with the cutting edge technology. We talked about CT, for example. We have this technology called FFRCT, which specifically looks at your blockage or your disease and gives you a risk profile for you. So we can individualize your treatment and certainly make it very focused on you. And I think that's very important. Nothing that we do is certainly cookie cutter, and I think that reflects in our patient care.
Well, all such great information. We all needed to know this. Dr. Jarrett, thank you so much for being here with us today.
Thanks so much again.
For more information, you can go to mainlinehealth.org/wellaheadphilly. Stay healthy, get your 150 minutes of exercise, and have a great day.
Well Ahead Philly helps you gain access to the information you need to feel better and live well every day. Thanks for watching 6ABC's Weekend Extra, paid for by Mainline Health.